Regional COVID-19 hospitalizations are continuing to increase as we get further into our holiday season. Right now, Ballad Health has 230 in-house patients. It's an increase of 21 people since Friday. 54 are in intensive care, with 41 of those patients on ventilators. Niswonger Children's Hospital has 2 pediatric COVID-19 cases. Joining us now, as always, Ballad Health Chief Infection Prevention Officer Jamie Swift. Thank you so much for joining us today, Jamie. Now, Ballad has seen an increase of nearly about 100 in-house patients the last 3 weeks. What are you expecting after the Thanksgiving holiday and into the Christmas season?
Now, unfortunately, we do expect to continue to increase between now and Christmas. We're continuing to see our number of new cases per day go up, and so we know that hospitalizations follow that. So we really don't see any sign of slowing down right now. So we do expect that trend to continue for the next little bit.
Last Wednesday, we reported that 100% of the patients in intensive care units were unvaccinated. What are you seeing currently as far as vaccination rates here in our region?
And we continue to see that trend in our hospitalized patients. And unfortunately, with vaccine in the region, it's really just stagnated. So our first doses, we're not seeing a lot of new people come in and start that vaccine series. Another place that we're not seeing the uptake I'd like is boosters. So we really need people to consider this Delta wave that we're in, to consider that Omicron is coming, to really please go get vaccinated. Start the vaccine series if you haven't. If you've been vaccinated and you're not boosted, please go get that booster.
The Omicron variant is something a lot of people are talking about right now, detected in several states. What's the latest you're hearing about this variant? And is Ballad doing anything differently to get ready for Omicron?
Yeah, we're still waiting on data to come out. So, there's every indication it's going to be more transmissible. We're still waiting on data related to, is it going to cause severe illness? There's really nothing special that Ballad needs to do. We prepare for COVID. So whether it's the Delta strain or the Omicron strain, we treat those patients the same right now based on what we know. And so it really is our main message, our main focus is making sure that we can handle the influx of patients, but also trying to reach our community and get them to the point that they'll consider and talk to us about vaccine.
Well, everybody's talking about this Omicron vaccine, but Omicron variant, you were saying that we're still in the midst of the Delta surge here. And so what are your concerns specifically with Delta as we head into the holidays?
Now, we've reached out to our health departments to make sure that this is what we think is going on, and every indication is this is still Delta. What we know about Delta is it is extremely transmissible. It also results in severe illness in those younger people. And so people need to realize that right now we are heading back into a surge, and a surge that I wasn't sure would happen. So it's extremely concerning that even before Christmas, we're going into this surge. I certainly don't want a repeat of last year at this time. And so it's really important that people understand that our cases are increasing, our hospitalizations are increasing. And now is certainly the time for wearing your mask, being more aware of where you are in social distancing, and getting that vaccine.
During a briefing today, Tennessee's health director specifically called out Northeast Tennessee's case numbers and hospitalization rates because they're a lot higher than the states as a whole. Now, our data from Friday shows that the 7-day rate is more than double the states, or it was only 40% higher a month ago. Do you know what may be causing this gap in vaccination rates as we compare ourselves to the state as a whole?
We've talked about that here. I really don't know why we started increasing first. I mean, certainly we need a much higher vaccine coverage. There are some regions in the state that are similar to ours. So, certainly it has started transmitting here. I do think it's kind of making its way back across the state now. So why it started here first, not sure, but we know what works. And we know that certainly masking, social distancing, getting that vaccine, those are all things we can do to try to slow this down right now.
Any words you want to pass on to viewers with the upcoming holiday season and everybody staying safe?
I think really you just need to plan your holidays, but to plan it safely. So certainly think about who you're gathering with. Try to make sure everyone's vaccinated. If everyone's not vaccinated, think about if there are things you can do. Certainly those rapid tests to give you an idea if anybody is positive right at the last minute. They're not 100%, but it's better than nothing. opening those windows if you can, eating outside if you can. There's a lot of things you can do to really make a safer holiday.
Jamie Swift, our thoughts are with you and all the rest of the staff members who are on the front lines of this pandemic. Thank you for talking with us today and passing along some great information.
Thank you.
And we will be right back. Stay with us.